Hello everyone, welcome back to Mamani Family Lectures, where we make pharmacy simple. In today's lecture, we are going to learn about intravenous infusions and rate of flow. And by the end of this lecture, you'll be able to understand why rate of flow calculations are very important when it comes to clinical settings, and also to know which kinds of patients mostly receive such kind of infusions. We shall be able to learn that, and by the end of this lecture, you'll be able to calculate any calculation concerning flow rate and intravenous infusions. Just pay maximum attention as I take you through this. For those who don't know me, my name is Mamani Dorot, and I'm a tutor. I am here to help you excel in your practical exams and theory at the same time. Where you don't get me well, please don't hesitate to raise your concern in the comment section. Pick up your pen and a calculator. Let's learn. What are intravenous infusions? First and foremost, intravenous infusions are sterile aqueous preparations administered in relatively large volumes, and they are mostly used to increase blood volume. Why? Because as we introduce a certain fluid into the body, we are ideally increasing the volume of blood. And secondly, they can be used to provide electrolytes. That one we are very much aware in instances where someone is dehydrated. You know, when you're dehydrated, you have lost some of the electrolytes from the body, either through diarrhea for people who may have running stomach, or for vomiting patients. You may find that some of these electrolytes are lost. So to replace them, we can administer an intravenous fluid, for example, Lingard's lactate, or normal saline, either or other kind of fluids. Then the other one, they provide nutrients to malnourished patients, or those in critical care, or they are used to administer medications. We have seen dextrose 50%, we have seen dextrose 5%. They are used to administer medications, even normal saline. Some medications are added to those infusions so that they can be delivered to these patients to achieve the goal of therapy or any intended goal, depending on what kind of diagnosis has been made. So what does that mean? These intravenous infusions are mostly administered to dehydrated patients. Just like we have mentioned about it, patients in critical care, we know those ones, malnourished patients, or sometimes patients prior to or during or after surgery. You know, during surgery, you're also placed on these infusions so that we can support the patient during that procedure. So sometimes they are also used during those procedures to support life. And these are commercially available in glass or plastic bottles. Sometimes they are in collapsible plastic bags. We have ever seen bottles of normal saline, bottles of dextrose 50%, bottles of paracetamol infusion. Sometimes they're in glass bottles, sometimes they're in plastic bottles, sometimes they're in collapsible bottles. we have seen all that. You can as well go, when you go for your placements, try to look up for these intravenous bottles so that you can have a look at them. And then volumes of 50 mils, 100 mils, 250 mils, 500 mils, and 1000. So all those volumes, bottles with different volumes are used to administer medications, nutrients, or electrolytes to patients. So, how do we administer these medications to the patient? Being in the collapsible bottle alone, it does not mean you can administer them. But an administration set has to be attached to these intravenous bottles so that you can be able to deliver such a drug to these patients. So that means we have to attach an administration set or the infusion bag in order to deliver the fluid into the patient's vial. But what are these administration sets? Administration sets may be macro drips, which deliver 10 drops per ml. When you say 10 grams per ml, we mean 10 drops per ml. So every meal contains 10 drops. Or these are normally known for being standard, but we also have micro drips. These micro drips are mostly used for pediatric patients, and they deliver 60 drops per meal. What are examples of these intravenous infusions? We have normal saline, which we mostly know has 0.9% sodium chloride. We have a half normal saline, which is 0.45% normal saline. We have 5% dextrose in water. We have 50% dextrose in water. We have lactated lingers, and so many others. So, what is flow rate? Flow rate is simply the volume per minute that a medication is delivered by intravenous route to a patient. Volume per minute that a medication is delivered to a patient by intravenous route. And it is used to calculate the rate of flow of intravenous fluids in milliliters per minute, or sometimes amount of a drug in milligrams per hour, or more frequently as the approximate duration of time of the total volume of the infusion. Therefore, it is role of pharmacy personnel to check for the rate of flow calculations before such infusions are delivered to the patients. So let's look at an example. And when you look here, you say flow rate is calculated by volume of infusion being multiplied by drip set, which we said we have macro drips and we also have micro drips. So flow rate or rate of flow is equal to the product of volume of infusion, which is in mils, times drip set, which is in drops per mil, being divided by time. And that time is measured in minutes. Sometimes it may be in hours or in seconds, depending on the format in which the question has been set to you. So let's look at our first example. So our first example. An education order calls for 1,000 ml of dextrose 5% to be administered over an 8-hour period using IV stent that delivers 10 gats per ml. How many drops per minute should be delivered to such a patient? So we need to summarize where we know that this intravenous infusion is supposed to be run for 8 hours. But the first thing we need to bear in our minds is that flow rate is calculated in drops per minute. So the first thing we have is to convert the 8 hours into minutes. But remember, we know that 1 hour is equal to 60 minutes. How about the 8 hours? This will be equal to 60 times 8 divided by 1. This will be minutes, and we shall get 480 minutes. So if we have 480 minutes, our main aim here, we want to determine at what flow rate will this fluid be run. They have given us the volume as 1,000 mils. They have given us the drop factor, or what we are calling drip set, as 10 gats per mil. So from our formula, flow rate or rate of flow is given by volume being multiplied by drip set divided by time. So when we compute, we have volume as 1,000. We have drip set as 10 drops per mil. Then we have time as 480 minutes. So when we compute this, we are going to get 20.8 drops per minute, which is approximately 21 drops per minute. So that becomes our answer. Someone may be wondering how we come up with drops per minute. But remember, this one is in drip set is in gats per mil. Then this one is in mils. This one is in minutes. So you realize that the mil and the mil is going to cancel, so that we remain with drops per minute. That's how we come up with the drops per minute. And remember, our question is asking for drops per minute. Or another person may choose to do it from first principle if you don't want to use a formula. And I will recommend all of us to buy this concept. After getting, we know that this is in these minutes. So we want to determine how many drops are there in this volume. But remember, we are saying that 1 mil has 10 drops. How about the 1,000 mils? This will have 10 divided by 1 times 1,000. And when you compute, we shall have 10,000 drops. But these 10,000 drops are in how many minutes? The 480. So that means that if in 480 minutes we deliver 10,000 drops. How about in 1 minute? Because they want drops per minute. This will be 10,000 divided by 480. This is not different from this. It will also give us approximately 21 drops per minute as the answer. So you can choose to do from first principle, which is highly recommended because sometimes you can forget the formula, or if you're in section A, you can choose to use the formula. It can take you to the answer in shortest minutes possible. Let's look at our second example. So, in our second example, a child is suffering from complicated malaria and is to be administered infusion of dextrose 10% in water at a dose of 60 ml per kilogram per day plus anti-malaria. A child weighs 3 kilograms. First question, calculate the daily infusion volume of dextrose 10%. So, our first solution will be the dose of the child is 60 ml per kilogram per day. But they want a daily dose. But remember, our child weighs 3 kilograms. So we shall say that if a 1 kilogram child receives 60 ml, how about a 3 kilogram child will receive 60 divided by 1 times 3, which gives you 180 ml. So the child will receive 180 ml of the infusion. Our next question, they are saying using an administration set that delivers 60 drops per ml. This is a micro drip at a flow rate of 40 drops per minute. Calculate the total time for the above infusion. Remember, we said from our formula that flow rate is given by volume times drip set divided by time. But our main aim here, we are looking for time. So we shall make time the subject of the formula, where we shall now have volume times drip set divided by flow rate. But do we know volume? Yes, it is 180. Being multiplied by drip set, they have already told us it is 60 drops per ml, divided by flow rate, which is 40. And when you compute this, you realize we shall have 180 times 60 divided by 40. We shall have 270 minutes as the amount of time that is required to deliver this volume of 180 ml to our child weighing 3 kilograms. Let's look at our third example. And where you don't understand, please make sure you ask or raise your concern in the comment section. I will be happy to help you. Our third example. Emma, a 10 kilogram 1-year-old girl, is to be administered drug in as an IV infusion 2 hours before surgery at a dose of 7.5 milligrams per kilogram body weight drug M is available as a 5 milligram per mil intravenous infusion and should be administered at a rate of 5 ml per minute. How long should MS infusion last? So, the fasting always, they have given us the dose that should be given at 75 milligrams per kilogram. So, our child is 10 kilograms. So, we shall say if a 1 kilogram child receives 7.5 milligrams, how about a 10 kilogram child? This will receive 7.5 divided by 1 times 10, and this gives you 75 milligrams. But remember, they are saying that this drug is available as a 5 milligrams per mil. So we shall see if 5 milligrams is in 1 mil, how about the 75 milligrams? This will be in 1 out of 5 times 75. These are mils. This will give us 15 mils of the drug. So 75 milligrams is in 15 mils. So what does that mean? That means we are looking for how long will the infusion last. But remember, we have the flow rate where we are saying that if 5 mils are delivered in 1 minute, how about the 15 mils? This will be delivered in 1 out of 5 times 15. And when we compute this, we shall get 3 minutes. So the infusion will last for 3 minutes. Let's look at our fourth example. So, our fourth example, 10 milligrams of the drug are added to a 500 ml large volume palatal fluid. What should be the rate of flow in mils per hour to deliver 1 milligram of the drug per hour? Part B, if the infusion set delivers 15 drops per mil, what should be the rate of flow in drops per minute? This is your assignment. Pause the video now, calculate it out, and drop your answer in the comment section. I'll be there to tell you whether you got it right or wrong, and I will be happy to help you get it better. And if you find this video very useful, please like the channel, share it with your colleagues, classmates, and students across the globe who may need this information so that they can excel in their laboratory practicals and also in their theory papers. And please don't also forget to like, subscribe to the channel to keep the channel grow and also keep you updated with more simplified pharmacy calculations, and as well turn on your notification button so that we can keep you updated with more information, more simplified calculation about pharmaceutics and other possibilities at the lab. Let's catch up in the next lecture, but don't forget to calculate this out so that you drop your answer in the comment section. See you in the next lecture.